Public Health Proposal: Community Mental Health Literacy Strategy for Rural Young Adults in Ireland. The World Health Organization says that globally, 1 in 7 10 to 19-year-olds experience a mental disorder, accounting for 15% of the global burden of disease in this age group. In Ireland, low levels of health literacy have been consistently found. This is among all age groups, but it especially affects young people in terms of mental health. Mental health issues such as anxiety and depression are common amongst young adults, and rural populations often face barriers including stigma, transportation difficulties, and limited service availability. In Ireland, there's still quite traditional mindsets regarding mental health, and this can force young people to believe that their problems are insignificant or not worth talking about because they might face backlash from their community members. Challenging this stigma is of utmost importance when tackling this issue. This proposal is deeply rooted in current scientific literature surrounding behaviours and public health policy. The health belief model relies on 6 facets that describe how behaviour occurs. These are perceived susceptibility, perceived severity, perceived benefits, perceived barriers, self-efficacy, and cues to action. In terms of susceptibility, young adults may not recognise their own symptoms. They may believe that they are something else, or that they could not ever suffer from mental health disorders as a result of the stigma they have heard. Young adults may also downplay their symptoms, believing that they're just having a couple of bad days or a rough patch, or that other people don't go through what they are currently going through. Seeking help can improve quality of life. Mental health can often be debilitating, and seeking help and getting the aid that you need can improve your overall quality of life. Stigma and lack of awareness are barriers that are perceived by young adults and by adults when it comes to mental health. These can often come from old communities and individuals who may not believe in modern mental health research. Support structures for young adults such as workshops or therapy groups can be critical in aiding young adults to help themselves in tackling mental health struggles. Educational campaigns and peer support are also critical in supporting young adults when it comes to managing their own mental health, and this is one of the interventions that we will explore later on in the presentation. Equally, the ecological model also outlines how behaviours happen. However, it takes it from an environmental perspective rather than an internal perception perspective. This is broken down into 5 components, which is individual, interpersonal, organizational, community, and public policy. From the individual perspective, improving young adults' mental health knowledge, coping skills, and confidence to seek help will reduce overall mental health pressures, and it will hopefully improve one's ability to talk about mental health more openly. Encouraging support from friends, family, and peers is also critical, as not only does it help reduce stigma, but it also makes the individual feel that they are supported in their journey in tackling mental health. Mental health education and support programs are the structures that facilitate young adults to seek help and to benefit from the help that they are accessing. Partnering with local community groups, sports clubs, and healthcare organizations enables individuals to seek mental health aid, and it is a great way of getting rid of some of the stigma, as sports clubs especially are hugely prevalent in rural communities of Ireland and can be a great pathway for individuals to learn about mental health. And public policy. Support policies and funding that improve access are fundamental components of a public health system when tackling mental health and need to be explored in order to facilitate support for young adults. Health education. Health education is a critical component of public health systems and interventions. Examples of this are social media awareness campaigns, educational workshops in schools, colleges, and community centres, and collaboration with local healthcare providers and community organisations. Individuals need to feel empowered and knowledgeable about mental health, which can aid them to recognise symptoms, to recognise that their symptoms are potentially severe, and to know what support services are out there for them. And health education is the way to achieve this. The first intervention I'm proposing is free mental health literacy workshops. Examples of this can be educational workshops in schools, colleges, and community centres that teach things like stress management skills, coping skills, and help-seeking behaviours to young adults as they are growing up. Some of the expected outcomes from this intervention is increased awareness of some of the mental health issues that can happen, especially the more common ones such as anxiety and depression, reduced stigma surrounding conversations around mental health and mental health disorders themselves, and better awareness of support services and hopefully an improvement in access to support services in rural communities of Ireland. The second intervention is mental health first aid training for individuals like teachers, parents, and community leaders in the recognition of symptoms of mental illness. Early recognition is critical in treating any sort of illness or disorder, and mental health is especially important as it can often continue to develop over time. Additional training can be provided in the types of support services that are available on both the public and private health spheres. And some expected outcomes of this are earlier recognition of mental illness, improved uptake of aid, and again, a reduction in stigma. I believe that this proposal is hugely feasible in the community, as core elements of enhanced support systems have already been implemented in Irish communities. The Health Service Executive already provides some mental health support services, such as free referral to cognitive behavioural therapy programs, GP care that can provide mental health treatment, and specialist services such as the Child and Adolescent Mental Health Service. And again, sports clubs and schools are major elements of Irish communities, particularly amongst rural communities, and can be hugely helpful in tackling stigma and conversations, as well as recognition of symptoms surrounding mental health.